Hi there, it's KMC here. I wanted to talk about an interesting topic that comes up from time to time, and that's the difference between a care plan, a treatment plan, and a payment plan. Now, obviously, a payment plan is a little different. That's easier to understand, but how they all fit together, I thought would be an interesting topic. We get this question a lot about care plans. It's very much a practice management term, very different from a treatment plan. So think about a care plan as that recommendation that the doctor makes for all the care that the patient may need. Could include their active treatment as well as their maintenance care, and maybe even care into their remainder of their chiropractic life. But the care plan is really laying out the care of the patient. It is not prescriptive to an episode of care. Where a treatment plan, and I'll just tell you, some doctors use care plan because they don't like the word treatment. It means something to them. However, a treatment plan is a very official item because it is a part of the evaluation and management service. It is one of the 5 required components in that initial visit of an episode of care. So a treatment plan is a required element of your documentation. It contains frequency, duration, all the care that you plan to do, the different types of treatment, an evaluation of treatment effectiveness, how you're going to know if it works, long-term goals, short-term goals, things of that nature. And it can be updated at subsequent reevaluations as well. So the treatment plan, very much a part of the care plan, could have within it a treatment plan, if that makes sense, because you're only going to talk about that active portion of the care. Some people do treatment plans only up until that first reevaluation, and that's okay. That's totally fine to do. It'll be re-upped or updated after that reevaluation is done. The last piece is a payment plan, and the payment plan sounds pretty obvious. The payment plan is irrespective of anything else that you're doing with the patient. Can include the patient's portion. If they're a cash paying patient, of course, it's all of the care that they may be receiving and what their portion would look like and their financial responsibility in the office. Now, what's critical to remember is that care plans are nice to have, treatment plans are required, and I think a payment plan is just a really good idea because most people can work chiropractic care into their budget if they understand about what their nut would look like to have to do on a monthly basis. I may not be able to pay you $2,000 this month, but if I could pay you several $100s a month over time that you're willing to put my credit card on file, that would be fantastic. And I love the different programs that allow you to do that. Our favorite happens to be the Cash Practice program. Very simple and easy to use, and a way to do auto debit, keep a card on file. It's a wonderful thing. If you're a member of KMC University, it's the auto debit system we use to process your monthly payments. The patient can pay the way that your policy says. So if you're happy with them doing a payment plan over time versus stopping at the front desk, deciding whether or not they really don't feel better, do they really need to make another appointment? Payment plan helps you to solve a lot of that. And so I would love to see the 3 pieces pulled together. So tell the patient the care plan. What does it look like to be a chiropractic patient in your office? Make sure your treatment plan is in writing in the required part of your documentation, and help the patient to have a payment plan to make care affordable so that everything that they need, they can get. I look forward to talking to you more about this. We'd love to hear your comments. If you want to comment at the bottom here, maybe tell us about some success or failures you've had and what you did about them, and let's get the conversation going. As always, we're here at KMC University to help. Don't hesitate to call. It never costs anything to have a phone conversation.